So let's begin. Respected our Dean Sir, Dr. Nigam, Dr. Chandrakant, and all our dear, lovely students. As already you are pursuing a course which is a professional one, and to be a true professional, it has to have some kind of definitions understood. And one of the things is that whenever we start a journey, we should also have some kind of a distant vision that where this journey will lead us. So many things are straightforward that you can identify, but there are few things which are either they are from far from your defined path or they are not known to you. But one thing is very good, that at least you have had two sessions before this, and it was already mentioned by so many mentors of this medical college that how to progress, how to develop, and what are the other options, even the best options. Today my session will be focused related with the medical science, but also taking this subject ahead to bloom yourself in your future. The situations arise one by one. First prof, second prof, third prof, and then internship. Internship was made to guide you that there are so many branches, just to have a glimpse of it and know that what are the best possibilities, and just to be aware of that. Unfortunately, our NEET exams, they, because you have to focus on those to clear those, and according to your situations or positions you have to opt some branches which are of your choice, some branches which are may not be of your choice. So here we will start with what are the options which you should prepare yourself right from the very beginning. So any career, whenever it has to be in a way, this is the wordings already it is start that you have to have some kind of motivation and it has to reach to a success. But the success, it is not an accident, but it is your hard work, perseverance, learning, studying, sacrifice, and most of all, love for what you are doing. That is a passion. And anything you know very well, if it is done with the passion, it makes a difference. Even your attitude, your personality, and your achievements, they make a difference, a huge difference. Okay, so here we will just focus on those points which will be definitely related with the medical careers as you have done your MBBS. Just after MBBS, apart from medicine, there are other fields. There are few things we will talk later on, but we will more focus on a medicine subjects. Here, one of the things which are arising is that you do a job or a service. Simple things, anybody can do it, either in the government or in the private. But there are also some opening, because once you do graduation, after graduation there are so many other options, and administration is one of them, in form of going through MPPSC or through the UPSC. Apart from this, there may be also some entrepreneurship in which you can start on your own as a business. But let us see what you have in your MBBS itself. Already after completing your 4 years and then 4.5 years internship, rural bond, 6 years and 6 months, you see that salary is a meager. It's not that much. You have to proceed for further. And you think, have I got good options, or there are no options, or only a teaching? But it is a wrong perception, as there's a vast majority of cases. Because I tell you, if you ask from any IITian, I tell you, one of the procedures, careers are there, they don't bother at all. They are just BTech people, they do it and just enter into the fields. Whatever the companies they see, whatever the nation they want to go, whatever the place they want to go, there is no barrier. So if you cross those barriers, you will see the maximum opportunities. And those, one of the opportunity you can see very well, that there are some things which are also called as a As a medical science technology, there may be also some subjects which are not of the clinical subjects, but they have got immense opportunities and they are really required nowadays also. You can do for MD or DNV, you can go for any diploma courses, but other management courses are also there in the form of doing MBA. You can go for any surgical branches where you can opt for the super specialization, but there are also some branches where related with the biotechnology nowadays, where you through engineering courses you go for MTech or any research workers as in the ICMR. So let us begin with our own degree courses, which is in the form of MDMS. And here, already you know, the 2-year course is a diploma, though it is in a very few cases, few subjects. But MBBS, after MBBS, you can go for 3 years post PG degree courses. And in these courses, these are two major divisions. Those two major divisions are medicine and allied and surgery and allied, and it includes a various subjects, and those subjects we'll just discuss later on. Or you can also go for any postgraduate medical entrance examinations, and after completing these courses you get a salary of approximately 30 to 60,000 per month. But in some private colleges, even during degree, they hardly get this thing. So for MD degrees, all these branches, anatomy to forensic medicine, are there. And for the doctor of medicine, there may be from pediatric, dermatology, psychiatry, TB, chest, radio diagnosis, anesthesia, and radiotherapy. Radiotherapy itself has become a very good branch because the cancer patients are a lot of there, and there are very good centers they are developing in our country. Similarly, for surgeons or surgical branches, you can go for the surgery, orthopedics, ENT, ophthalmo, as well as obstetrics and gynecology. And I tell you one word to speak about it, that don't be fearful of these subjects which you think that you have to work for a night duties, you have to be standing for. Actually, what happens, it is an adaptation. Once you adopt and you see that this knowledge is practically useful for the society, and you are one of those people who have given an opportunity, you will enjoy this thing. I said in the very beginning, if you develop a passion, there is no tiredness at all, even if you work for 24 hours. Only thing is you have to take those steps in which you maintain your physique as well as the mind. Solo mind in solo body. That is one of the things, and you have to take care of that. DNB, already this is a diploma of national board, and it is one of the very good career options nowadays. It is available, and it's just a centrally examination is also there for that. And if once you do, it is a well recognized all over the country as well as abroad. So you have to go for DNB. No, they never feel hesitate in joining DNB also. Only thing is that there are few hospitals who have got a good clinical exposure. Only that is the one of the limiting factor. Otherwise, DNB itself is equivalent as well as recognized abroad also, and you get a good handsome salary or stipend also. Coming to super specialty or sub specialties, already master, that is a courses, that is a MCH for surgical disciplines, DM for the medicine disciplines, and it is again a 3-year courses already being done at a very good centers, that is the tertiary care centers, or you can say all postgraduate PGI centers. But here what is going on, they have developed a very focused knowledge and very you can say to develop the super specialty courses related with that topic or subject only, and this is one of the requirement of the time. If you want to settle in a very good city, because everybody wants that I should reach to such a level that my name and fame is also with that, so this is one of the options where super specialization helps a lot to you. And mind you, these all are required nowadays because we have developed this science under tertiary care centers. Coming to other options, where, because I wanted to tell you right now, though there are some things which there's combined medical services, which is one of the centrally organized exams, and by that you get a salary, a good handsome salary, but the job is of the central government. So it is a permanent job, number one. And the written and viva examination are two things. After clearing your written examination, these interviews are taken at the UPSC, the place where the film 12th fail has been already done. And I also every year go for this UPSC as an interview board. So here the pattern you have to understand. The interview, any interview, how to crack those interview, that is the purpose of this kind of things. In the interview, it is a kind of a personality test. The word is said as a personality. Mind it, this will, nobody will tell you what I am telling today. Because the person who itself takes the interview, they know it, what are the things which you have to focus upon. For personality test means you, what you are, means what comes out of you. Whether your knowledge is really knowledge or you are just trying to show the knowledge. This is one of the very things. So be true to your inner core. Means you know, that's very fine. If you don't know, please let the examiners know that you don't know yourself. It is a keyword. If you can understand this, what I am saying. Don't poke the examiners to let you understand that examiner has understood that you don't. If you point twice, this is one of the things. So it is, be true to your thing, and use, I say truth always wins. Your knowledge will be definitely useful, and for that purpose we always focus upon you, or telling upon you that your classes are not meant only just to mug the subject, but to understand that where do we exist regarding our knowledge. Basics never change, and they are really useful for throughout the life. Okay, so I am not going into detail of this. So this can be done very well. This is equivalent to a very good career options and UPSC can be cracked also. Coming to this is management courses. Nowadays there has been a very good career options also. The corporate hospitals have come, and you don't underestimate them. Recently I went to Chennai, sir ko bhi malum hai, with courtesy dean se, and this was a 4 days of a very rigorous type of the surgeons conference, national level, even international people ke. We were connected with the British madam was there, some Dale, some Madam Dale was there. So already the barriers, as our further co-colleagues will also guide you, that nowadays nothing is a barrier, because you are also communicating with so many people all over the country by this social media and all this platform. But here also this management has come up. So corporate hospitals running with the 1,000 crores, 2,000 crores of the projects, which we are not thinking about it today, but they are coming soon. Wokhart, or already so many big these cardiac sciences, neurosciences, or these oncosurgeries, oncological procedures, and so many hospitals are coming, and they are definitely dealing with the international standards. Even the one of the thing is going on, and that is called as a medical tourism. Okay, it is way too early to talk with you about the medical tourism, but medical tourism is one of the very fast growing multi-millionaire things where the international people, because our country is full of brilliancy, only thing is that we lack in some resource and resource utilization. Resources are there, just only thing is required is a resource utilization. So even in Delhi, I visited to Mata Anandamayi Hospital at Faridabad, and there I saw that already a helipad is there on the hospital's top, and there international people are already coming, as a medical tourists, they are getting operated even for simple dental procedures, eye procedures, cardiac, neuro, everything like a 7-star hospitals. Don't think about it that you are studying here, so you cannot reach to up to that place. And they are spending a lot of money because still it is cheaper than the abroad countries. So you can go for MBA courses and become a like a superintendent or any director of the health and like that also. And that the courses can be done from the cracking the CAT examination and getting entry into the IIMs, IFMS Delhi, Hyderabad, MDI Gurgaon. So many centers are there. Initially, they don't get a stipend, but rather they charge for you. There is a heavy charges also, but these things are really cracking for you as another options. You can go in the ICMR as a clinical research. This is another option which can also join with the WHO. Many other institutes like AIMS, PGI, NIMHANS Bangalore, Tata Institute of Fundamental Mumbai, and they also offer a PhD degrees, and that can also be done. Another one is the Master of Hospital or Health Administration. Again, this 3-year postgraduate degree course is also there in health administration. By that also you can become big specialty hospital managers or even the directors. This is again a MTech course. Don't think that you cannot go for this. It's in the biomedical engineering and biomedical sciences. So for that you have to pursue a little different one, or there is a master's in the medical sciences and technology courses. Public health administration is again one of the topics or chapters which you can take up as a one of the careers. Another one for our own state, not only state but our country, the state health services. The state health services also, it may be having a little longer incubation period, a little duration, but there is also options we can reach up to the joint director, deputy director or director health. But after this, serving our state and then getting preference in your entry to the PG courses after serving for 5 to 3 years in the primary health centers. From here, you can also plan the various courses in the abroad, and that is for the United States Medical Licensure Examination or PLAB, that is Professional and Linguistic Assessment Board, or Fellow of Royal College of Surgeons, or you can see also for MRCP, which is not written here, which is mandatory nowadays for as a member of Royal College of Physicians. And other FRCS courses can be done in Canada, Australia, New Zealand. So these are well recognized all over the world. And fellowships can be done, which already we have talked about it. And then coming to what we are here is a medical education department. You know very well that new medical colleges are coming up, and our Prime Minister office already had established that soon we will be making the colleges in all over the country, mostly covering whole of the India. And here teaching courses will definitely be pursued, and those posts will be like this, that you can join plain after plain MBBS, either demonstrator tutor, but nowadays it as a mandatory SRship has come, so you have to go for any PG courses. That will be very helpful. These are the clinical temporary posts as a JRSR, but there again the career starts as a faculty members by becoming, initially it was talked about as a lecturer, reader and professor. Nowadays we ask say for assistant professor, associate, and then again further development, and some cadres will be given to the private medical colleges. Corporate hospitals, they are upcoming also. But one thing is very important, that you should know your subject. Otherwise, wherever you go, after a trial period of 1 or 2 years, the people want to get rid of you. So your subject knowledge, go on reading, studying, whatever the course you pursue, you should have its depth, knowledge in the depth. Other jobs may be from the Army Medical Corps also, where you can join. There is also a good discipline. Those people I have seen, those who have joined Army Medical Corps, AMC, and they have become up to the lieutenant, they are also of such a discipline that they enjoy that life, and they are also given due seniority, due respects, and also sufficient salaries. So that can also be opted. Other jobs which can be done at the CSC district, we have talked about it. Specialist, you can be given as a first class 1 jobs after 7 years of medical officer work, and you will get a preference of the entry to the PGs. And civil surgeons who runs the civil hospital, that is the district hospital in that particular districts. Central government, already I have talked about it. By that you can also get entry into the central government health services hospitals and ESI hospitals also. That is one of the things. And army, we have talked about this. Lieutenant, you can become. General entrepreneurship. Nowadays, one of the things which I want to tell you about, that never hesitate to develop your own. जैसे बात करते हैं कि we are doing jobs, we can be job creators also. And in that field, only thing is that you should know that how any unit works. If you understand how the unit works, that is then only you can go for entrepreneurship, and you can develop your own either clinic, either polyclinic, single specialty hospital or multi specialty hospital, or there may be a chain of the hospitals. Nursing home or corporate hospital or labs development. Can you understand, or you must have seen on your WhatsApp messages, one message was floating within I think last month, that top 10 entrepreneurs of the medicine who are multi-millionaires. Usme one name came as a Lal Pathology Lab. I tell you, I was a senior resident at Delhi at that time in Safdar Hospital, and it was a very small at the Connaught Place, Hanuman Mandir ke paas, like that. It was very, and from even those tests which were not being thyroid tests, or where there some special cancer tests were not being done in our government hospital, then we used to send. Now you can say where within this span, hardly 22 years or 23 years of span, where he has gone. So don't underestimate this. These labs or imaging sciences or investigatory labs, they will be very, very helpful, because everybody has to undergo investigation. There is a corporates which allow every their employee to get yearly checkup done. I think you must have known about this, that they ask and they reimburse the money to their employees to get their yearly checkup done. So this is one of the options which are available. And then coming to other type of the scan, MRI, CT scan, or there may be other diagnostic centers, and there may be also for trauma centers are developing. So those people who are doing like some orthopedic or neurosurgery, I tell you, they can develop their own trauma centers. They are well recognized and they are need of the time. Other daycare centers, this is one option. So our class or this setup is meant just to let you know that what are the different varieties after MBBS that you can proceed to think about in a progress in that manner, is just going for a development of a daycare center, so that everybody is fast moving. They want that there should be a limited, their work hours must be restored. They should not feel too much time given to. Even our NABH hospital is there, and what is there mentioned as is that your work is efficient is turn around time. That if a person comes, if they enter into the hospital, how quickly you let them return back to their work. That is called as a turnaround time. So here, if you reduce that turnaround time in the form of daycare centers, it will be very useful for that, where endoscopic procedures, minimal invasive procedures or minor operations, even cataract or eye surgeries, reductions, piles, hemorrhoid surgeries, hernia surgery. I tell you, this is one of the very, very vast number of population is suffering from these diseases. It is very underestimated. But if they are develop a good centers, there in the already there is a uh, Mayo's Mayo's hernia clinic. This they don't do anything in the world. They only operate only Mayo's hernia clinic. That's it, and it is state not only state of the art, it is beyond par excellence in the world. That is why. So you can go for that, or angiography, angioplasty. This is one of the things which is now required day by day. I have just kept this thing. Those who have extra time, sometime you are free, that this is your vocabulary is very good, this medical dictionary terms, so you can opt for this. This is only for part time. People can go for transcription, being a transcript, because you need a good listening, good language skills, and English knowledge, English language. Here another thing is for the again civil services examination. I'm not going in detail, but there are doctors in all other states, and I have seen myself that the people from All India Delhi, they are appearing in this exam. They have come and I have interviewed them for these also. So we can go for this preparing for civil services examination, because इसमें आपको बार बार पढ़ना पड़ता है और उसमें सिर्फ एक बार पढ़ना पड़ता है. So this is the difference. Okay. So for that, I just few words for the aspirants, if anybody can pursue, because my friends from Indore MGM are also few who have become IS. They are at right now even beyond secretary level at Mumbai. They are well settled. So for this only, for you, that is, you have to start early. That is one of the things. It takes minimum 5 to 6 hours to 6 years to prepare well, and this is a continuous process. हमें हार नहीं मानूंगा, रार नहीं मानूंगा वाली बात से स्टार्ट करनी है, and you have to give enough time, starting with the very basics, NCERT books to all type of the journals as well as the current affairs. So to sum up, don't think that it is only a single course, that you can go for a lot of things. Business modules are many, jobs are there, the government sectors are there, the private sectors are there, administrative sectors are there, as well as, but you have to be one of the people who can pursue their passion. So whatever passion you have, you can go for it. There is no limit, and these options are so many. So already we have talked about this. Some people also opt these things after retirement. It is nothing. It does not end. After retirement also some doctors think that यार मैंने अपनी लाइफ में जो मुझे करना था अभी तक नहीं किया. So this is also an option. So journey begins and it never ends. Thank you very much. And the last, already we have done this thing. This is the thing, what we think we become. This is one of these very small things, but these sutras, they help a lot. What you think you become. Thank you very much. निकाल दो, निकाल के ले.